Hi, everybody. Welcome to MBA 600 Health Systems in the U.S. My name is Professor Sarah Bonzo. Some of you I have had the pleasure of having in class before, so welcome back to another semester with me. For those of you that are new, I look forward to meeting you and hearing more about what you do, what you want to do after you finish this program. Hopefully, again, we can get all of our one-on-one meetings scheduled here throughout September so I can get a chance to have that one-on-one connection with you and understand what you're looking to accomplish and how we as a program here at SUNY Oswego can help to support you. So getting to this class, health systems in the U.S., it is a complicated topic. It is a quasi-free market system in which we provide care. Meaning that we don't necessarily are, as patients, we don't have transparency in how much something costs, what kind of quality we're getting, where we would have that feasibly in any other industry where we are choosing to go and pay for services. But again, we're not really paying for it. It's possible that we are self-pay, but it's unlikely. More than likely, we have some employee-based coverage. We have health insurance, maybe through Blue Cross Blue Shield or someone else, or possibly we are covered by Medicare or Medicaid. And depending on all of those factors, the place where we go to get care is going to get paid a different rate based on the services that we receive, what type of insurance we have, and our need for those services. So it's complicated. So we're going to attempt to try to break that down, at least have a common understanding of the terminology, the framework for a healthcare delivery system, some of the challenges, some of the opportunities. And again, I look for all of you to try to bring in your experiences to those discussions as much as possible. We've got people in the course who work in inpatient acute care as physicians, as pharmacists. We've got people on the outpatient side. We've got those of you working in behavioral and mental health and home health. And the system, it acts differently depending on where you work, what your role is. And hopefully all of you are going to be comfortable enough at kind of sharing your experiences, your frustrations, and also some of the things that make you love doing what you do. Here I've got an image up of the quadruple aim. I love, if you have an opportunity, check out the IHI website, Institute for Healthcare Improvement. Historically, they've had a triple aim focused on improving population health, reducing costs, and increasing quality. But in the past couple of years, it's shifted a bit to this quadruple aim. And that's because we're seeing that more and more we are having really frustrated providers, typically call it physician or provider burnout, right? Because we know that the demands that are being placed on caregivers are more strenuous than they've ever been in the history of our healthcare delivery system. And it's really hard to think about how we're going to increase or improve population health and reduce costs and increase access and increase quality, all these other things, if the people that are doing the work and providing the care aren't kind of feeling that good feeling about why they may have gotten into the discipline in the first place. So we need to make sure that the demands are reasonable, that we take into account kind of the human factors or the cognitive piece of what is a reasonable workload and how can we work together in multidisciplinary or interdisciplinary teams to address some of these challenges. And the core goal at all of that is having satisfied patients. As we think about redesigning care delivery systems, how can we do it so we're providing better care, care that we would want to receive as a patient, care that we would be comfortable having our family members receive, knowing that it's not going to be extraordinarily expensive, knowing that we can assume that there's going to be a decent level of quality and that we're going to be able to work with the care team to know exactly what we're getting into, what our options are. There's so many factors, but again, it boils down to what kind of care do we want to receive for ourselves and for our family, and how do we design a system that enables us to do that. The way the course is structured is the first half is going to focus on understanding some of these core principles and concepts. We're going to talk about the historical foundations. I would encourage all of you, make sure it's a bit of a dry read, but it is considered to be one of the preeminent texts in terms of delivering healthcare. This is an older version of it. Hopefully you have an updated version. You can rent them from Chegg from Amazon as well. Delivering healthcare in the U.S., there is a great chapter on historically how have we kind of gotten to this place, this complexity in our care delivery system. We're going to talk through the health professions, what the delivery system looks like, all of the players, how it works together or doesn't work. We call it a system, but that almost implies that there's some level of collaboration and coordination, which is often not there. How do we pay for healthcare? How do we think about managed care, accountable organizations? What are these things? Why are we transitioning to them? How are they changing? And again, that's going to focus on reducing costs, increasing access for everybody, and improving or providing better care or increased quality. So the first half is going to be very qualitative, focused on discussions. We will have a midterm exam again, where I will basically give you the week to complete the exam, but I'm going to be asking you questions about all of these different topics. Now, the second half of the semester is going to be focused on measurement. So one of the things that is becoming increasingly important in healthcare is value-based care, right? We want to know that there are core metrics and we want to see the needle move on those, whether it's reducing length of stay, whether it's improving outcomes, and there's a number of different ways we can measure that, whether it's patient satisfaction through your HCAHPS scores, right? There are all these things that we're measuring. But how do we break it down to a more granular level? How do we look at, instead of just those big outcome metrics, how do we break it down and look at some of the process metrics that are actually going to help us figure out how we can achieve, how we can provide better care at a more local level? So we'll be looking at measures of inpatient use. How do we adjust based on the age of our population? One of the things that's changing is that our population is growing older and older. So how do we take that into account when we're looking at the care that's being given and how much of it the population that we're caring for is receiving? We're going to look at institutional measures of use, outpatient measures of use. So the second half is definitely going to be more quantitative, where the first half is more qualitative. But during this time too, you're going to have a final paper on a topic of your choosing, something that you find interesting, something that is presenting a challenge or maybe an opportunity for you, depending on where you work. And so you'll also kind of behind the scenes during the second half of the semester be working on this paper as well. So a few key challenges. I already mentioned that we've got aging demographics, so the age of the population is increasing. We know that healthcare costs are continuously rising at an unsustainable rate. Patient expectations are changing. We're starting to want to see more transparency, just like we do on Yelp. We want to know that we can go and we can understand what the ratings are for a facility. And one of the things that we've seen in the past couple of years is the implementation of CMS star ratings, which is basically a 5-star rating, just like you would have on Yelp for a restaurant, which takes into account 54 different metrics of quality, of patient satisfaction, of things that you would hope to see in your facility when you go and receive care. Basically, all of these values are reported to CMS. They use an algorithm to basically generate a star rating for each facility based on those metrics. So there is a push, even at a national level, to start to provide more transparency, but we're looking at patients even wanting more than that. So what does that mean, and how do we respond to that? Also, security, privacy, compliance. We know that one of the big challenges that seems to persist. I know when I had worked at Rochester General Hospital about 6 years ago, part of my role was implementing Epic at the system level, revising workflows, working with leadership teams, kind of having these process improvement sessions to figure out how we can deliver care better, how it's going to change with the EMR. But we are still not using it to its full extent. Electronic health systems are wonderful and have the opportunity to make major improvements kind of on all of these fronts, but in many cases we're not using all of that technology yet in terms of providing business intelligence and giving us indications of how we can improve. So there's opportunities there. There's also opportunities with interoperability, making sure that systems can talk to one another, so that you don't, your patient records can be easily transferable. And then there's a whole host of HIPAA compliance issues that go along with that interoperability. So it's a really interesting time. There's a lot of challenges, but a lot of great opportunity as well. So some of the trends and opportunities we're definitely seeing a shift to outpatient care, which we'll talk about more throughout the semester. Use of telehealth for visits, a transition to urgent care, which is fascinating because we don't even know the extent to which urgent care visits are taking place. There is no governing body that collects records in terms of how many visits are happening at urgent care facilities. So it's wild. We're trying to do some research here at SUNY Oswego, myself and Professor Thornton, looking at the impact of urgent care facilities on emergency department visits throughout New York State. And it's really hard. We kind of have to massage the data a bit because we can see how many urgent care facilities are popping up in an area in any given county, but we still don't know exactly how many patient visits are going there. And how is that impacting or replacing as a substitute or complement primary care and emergency department visits? So the verdict's still out because the industry has been there for 5 to 10 years, but we still don't have the data around it to really understand to what extent it's changing things. A focus on alternative medicine practices, yoga, meditation, cognitive behavioral therapy. We're constantly looking at opportunities for using Lean, Six Sigma, continuous improvement techniques to improve care delivery. A focus on proactive care as opposed to reactive care. Personalized medicine. We're seeing constant mergers and acquisitions, and I'm sure many of you have been affected by that, all focused on creating value for our patients. So that boils down to value-based delivery and how eventually we will be reimbursed for that. So next steps in terms of getting started with the course, I'd like for you to introduce yourself if you haven't done so already. Look through Module 1 in Blackboard. I'd like for you to read chapters 1 through 3 in the text. So we've got 2 weeks here for this initial content to get you up to speed. When you're ready, please feel free to go ahead and post for discussion 1. I do have a rubric in terms of my expectations and how I grade. What I ask more than anything is I want you to be respectful. Healthcare and policy is a very, very hotly debated topic, and you might think that healthcare is a right, and some of you might think that it should be governed by free market conditions just as any other industry. And all I ask for is that you be open to hearing other perspectives. And when you post in these discussions, I just want you to support them. Try to keep it as factual as possible, pull in as many resources as you can, and again, be respectful of your peers. In terms of additional resources, one thing I would like to ask for all of you, I'd like for you to sign up for Modern Healthcare AM. It is a daily email along with Becker Hospital Review, and my intent is not to bombard you with emails, but both of those are going to give you a very good snapshot every single day of what's happening in healthcare. What changes are coming down the pipeline in terms of policy, how is it impacting care, what are some of the issues that are happening across the country with different health systems. And again, it gives you a good feeling for what are the big challenges, how are people trying to address them. So please, if you can, sign up for those two lists. I also have some suggested reading, which is not going to be required for this course, but something I think you might find interesting. A book that just came out 2 years ago is Bellevue, and this is more of kind of a tale, an easy read, but it really gives you a good perspective in terms of how the healthcare industry has evolved over time. So it follows Bellevue Hospital, and from almshouse days to what the institution is now and how they do business. So a great history of healthcare overview. 2 other books by Atul Gawande. So one of them is Better, and I don't have the cover on here. Another is Checklist Manifesto. Another book by Atul Gawande is Being Mortal, his most recent. All of these reads are exceptional, and I would strongly suggest that you add them, that you get a feel for who Atul Gawande is, because he is going to be a very prominent figure in healthcare, as he has just been appointed CEO of this new entity between Amazon and, it's escaping me now, Jamie Dimon, and also third person is escaping me, but I'll send out an email to everybody in terms of the this new kind of powerhouse and how they are trying to disrupt the industry and try to figure out how they're going to deliver care differently, starting with their own organizations. And Atul Gawande is going to be leading that front. So all of his books are wonderful. I would certainly suggest that you read them. And the next, which is very recent, which came out just this summer, is Reverse Innovation in Healthcare, How to Make Value-Based Delivery Work. Another excellent read in terms of what does value-based delivery mean and how do we think about actually implementing it and making it work. So much is changing and it's hard to keep up, but fortunately with some of these books, they make for enjoyable reads and they give you something to think about in terms of not only where the industry is going, but what you can do personally to provide better care for your patients. So with that, if you haven't done so already, please sign up a time to meet with me. I look forward to working with you all.